Hi, I'm Dr. Shirley Salins. I'm an associate professor working at Kasturba Medical College, Manipal, in the Department of Radiation Oncology. Today, I would like to speak to you about motion management when patients are being considered for stereotactic radiotherapy treatment for either lung cancer or metastasis to the lung. Now, lung is a very unique site where both primary as well as metastatic tumors can develop, and this can be very easily targeted with stereotactic body radiotherapy. The main challenge in treating lung is that the lung moves with breathing. Sometimes the motion can be as high as 1 to 2 centimeters. This becomes quite challenging for the doctors to accurately target the spot on the lung. Hence, it's important for the treating team to decide how much the tumor in the lung is moving. There are various ways to see how or to what extent the lung moves with breathing or the respiration. It can be a 4D scan, which is a very specialized type of CT scan, which will capture the motion of the tumor in different phases of respiration, or it can be as simple as a X-ray fluoroscopy, which will tell us about the extent of the tumor motion. The treating doctors or the radiation oncologists need to see how much is the motion of the tumor. If the motion of the tumor is more than a centimeter, we have to use different other methods to reduce the motion of the lung so that the amount of radiation delivered to the lung is kept to a minimum. There are different methods one uses to dampen this motion. Either we can ask the patient to hold their breath so as to reduce the lung motion, or we can actually deliver the treatment in that particular phase of respiration, which is called respiratory gating. When the respiratory motion is less than 1 centimeter, then it is acceptable, but it is important to take all the motion into consideration while delineating or deciding the area to be treated. In that case, it's important that the doctor identifies the tumor in all the phases and gives that extra margin to the tumor while treating, so that we accurately treat the tumor without risking a potential miss at the time of delivery. This very step of motion assessment and management is one of the most crucial and most important step when radiation is planned for the lung. Hence, every radiation oncologist should take extra consideration and effort to utilize various methods available to understand the respiratory motion and use appropriate technology to reduce the motion or encompass the motion. So once we've done the assessment, it's important that we train the patients to be able to do these advanced techniques. So usually the steps in planning radiation would require a CT scan, but prior to that, we would like to see what is the breathing movement as well as what is the normal profile of breathing. Hence, these sessions may require some more additional time prior to the actual CT scan, and patients must be willing to come for these additional visits, which will actually help deliver their treatment very accurately. So the doctors will have assessment of their breathing or the respiratory reserve, which will involve assessment with the help of a pulmonologist. And once we have done that and assessed the respiratory function, we will see how is the breathing, whether it is regular breathing or it is irregular. There are different ways to help improve this breathing as well. We do utilize spirometer and other techniques to actually coach the patients so that their breathing becomes much regular, or they are coached very well to be able to hold the breathing. What is more important is that they consistently hold the breath rather than the duration. So at least 15 to 20 seconds is a minimum requirement for holding, if that's what we are considering. Now, even in patients who do not have good lung reserve, that means they're not able to take a deep breath or hold their breath, even in those patients, we will be able to plan these advanced technique with the help of doing the 4D or the respiratory gated scan, where we will look at all the different positions of the tumor motion and encompass that to planning. So there is actually no patient who possibly will be a contraindication or unable to be treated by this technique, barring very few indications. So hence this whole technique is very specialized, and additional interest as well as training into breathing is very crucial. For more information like this on treatment plannings and assessments, do join Lung Connect. Thank you.